And today I want to tell you my experience as a physician who needed to find another physician and my interaction with the greatest healthcare system in the world, SouthCentral Foundation. Pardon my hoarseness, but I do have asthma and that's what led me to do this. Here's the story. I've been living in Phoenix for over 20 years. Every year around April, there's a lot of pollen that comes. And after being here several years, I became quite sensitive to the pollen. What happened that every April I'd have to take a little bit of Zyrtec. I'd have a runny nose, upper congestion, etc. And that became kind of a routine. This year it was particularly worse. Started out as some simple symptoms, got rapidly worse to where I was having to use an inhaler several times a day and night in order to stop coughing and not breathe. I had to go to Alaska for a meeting. I was looking forward to getting away from the pollen. But even up in Alaska, while I breathed the fresh air and it didn't taste like sandpaper to my mouth and irritation to my lungs, clearly there was still a lot of inflammation. And that night I had a horrible night trying to catch my breath while sleeping because the inflammation caused by the pollen here was still raging strong in my system. I knew I needed to see a doctor. So I thought, well, maybe I should see one of the physicians at SouthCentral Foundation. After all, I'm on the board here. I know some of the physicians, but I was a little bit concerned. But I did. I knew Steve Tierney. I sent him an email saying, maybe this doctor needs a doctor. Described my symptoms. Meanwhile, my hypochondria was thinking, maybe I don't have asthma, but maybe I have lung cancer or heart disease. Every doctor is the biggest hypochondriac you will ever meet. And I'm no exception. Steve Tierney contacted me just before my meeting, said, where are you? I said, explain where I was. He came up with a big smile, asked me a few questions, looked at me intently, listening to the answers, and said, we need to add a couple of prescriptions. You want to pick them up at the local pharmacy, or do you want to enroll here? I said, let me enroll there. So here was the greatest healthcare system in the world I hadn't enrolled, even though I was on the board. So I enrolled. It took me less than 5 minutes. He put in my medications. They were delivered to me within an hour. No cost to me, no deductible, no copay. That's how it is at SouthCentral. And yet that healthcare system has the lowest cost of any healthcare system in the United States. Shortly I was feeling better. I emailed Steve out my progress and we chatted back and forth. But what it pointed out to me is I had access because of who I am, because of being Native American, because of this little BIA card, to the greatest healthcare system in the world, which we are trying to show to the rest of the world that you can have access there. Anybody can see a primary care doctor the same day. Rates of asthma going to ERs are much lower because they deal with it constantly and take care of it as an outpatient. Chronic pain is taken care of as an outpatient, and costs are much lower. I got to experience it firsthand. So learn about SouthCentral. You can read about it a little bit in our blog, and I've written about it before. It truly is the greatest healthcare system in the world at the lowest cost, providing great primary care to people. And even this doctor, who's a super specialist and a skeptic, will tell you, when you need a doctor, you want someone who will build a relationship with you. And that's the kind of care that we get there. For your doctor's orders and as a patient, I'm Dr. Terry Simpson.